More than 40,000 women in the United States will die from breast cancer this year. It remains the second leading cause of death in women and the leading cause of cancer death in women ages 35 to 60. Decades of research have established mammography as an excellent screening tool for breast cancer. Yet only about 65% of women aged 40 and older report having a mammogram in the last 2 years. Guidelines around screening mammography are confusing. We recommend that all women, regardless of risk status, begin annual screening mammography at age 40 and continue for as long as they are in good health. In addition, all women should undergo a risk assessment by age 30 to determine whether they require earlier or more rigorous screening for breast cancer. Following these guidelines saves the most deaths from breast cancer. A woman's risk of getting breast cancer rises sharply at age 40. In fact, women ages 40 to 44 are twice as likely to get breast cancer as those 35 to 39. Nearly the same number of women in their 40s are diagnosed with breast cancer each year as women in their 50s, and more than 75% of women diagnosed in their 40s have no family history of the disease or other factors that would make them high risk. When women wait until age 45 or 50 to begin screening mammograms or test every other year, it often results in more extensive treatment when breast cancer is found and leads to thousands of unnecessary breast cancer deaths each year. For Black women and those with a family history of the disease or other risk factors, the risk rises even earlier. That's why we recommend a risk assessment by age 30 to determine if earlier screening is recommended. Evidence for breast cancer screening effectiveness comes from many sources, including randomized control trials, or RCTs, and observational trials. RCTs are the gold standard because they attempt to control for biases, but they have weaknesses. There are 11 screening mammography RCTs involving nearly 700,000 women. Together, RCTs show an average 22% reduction in breast cancer deaths with screening. But the RCTs underestimated the benefits of screening. They used outdated technologies, and many trials used only one image of each breast rather than the 2 images performed today. Noncompliance and contamination also caused screening benefit to be underestimated. In contrast, observational trials include many more millions of women across multiple countries and show a significantly higher drop in breast cancer deaths with screening. One observational trial, the Pan-Canadian trial, involved 2.8 million women, 4 times larger than all RCTs combined, and showed a 40% drop in breast cancer deaths with screening. This was found in all age groups, including those aged 40 to 49. Despite not testing all eligible women, breast cancer deaths have dropped about 40% since mammography became widespread in the mid-1980s. Some say this is only due to treatment advances, with no contribution from screening. If that were true, then men with breast cancer who get the same treatment as women but who are not screened should have the same death rate drop as women. But for men, the breast cancer death rate has remained virtually unchanged. So treatment alone is not responsible for the plunge in breast cancer deaths. Early detection with screening mammography is critical to make this happen. The American College of Radiology and Society of Breast Imaging advise women to start getting annual mammograms at the age of 40 and continue as long as they are in good health. This approach saves the most lives and the most years of life for women.